If you are over 60 and you have started waking up at night to pee more than once, or you feel like you never quite empty your bladder, I want you to listen closely. These symptoms are not just a normal part of getting older, they are signs that something deeper is happening inside your body. I'm Dr. Sarah, a specialist in men's health with over 20 years of experience, and I've seen this exact pattern in my practice thousands of times. Your prostate is trying to get your attention, and in many cases the problem isn't your agits, your daily habits. Quiet little things you do that are making the issue worse. Subscribe now, because what I'm about to share is practical information that often gets overlooked. In this video, I will walk you through 3 incredibly common habits that quietly contribute to prostate enlargement. Once you know what they are, you can start making simple changes today to find relief. The science behind this is fascinating, and it could make a real difference in your comfort and quality of life. Now, I want to share something that might surprise you. In my 2 decades working with men experiencing these exact symptoms, I've discovered that the real culprit's often hiding in plain sight. 3 everyday habits that most men don't even realize are putting constant pressure on their prostate. Let me start with Robert's story. He's 68, a retired accountant who came to me already working well with his urologist. What Robert wanted was to understand why his symptoms seemed to be getting worse despite following his doctor's treatment plan. I coordinated with his medical team, and together we identified these 3 habits in his daily routine. Within 6 weeks of making simple adjustments, Robert noticed he was sleeping through the night more often. His doctor was pleased with the progress during their follow-up visit. Today, Robert continues both his medical care and these natural approaches, feeling more in control of his health than he had in years. The first habit might seem harmless, but it's actually creating tremendous pressure on your prostate every single day. It's holding your urine too long. Here's what happens when you consistently delay urination. Your prostate sits right below your bladder, wrapping around your urethra like a soft collar. When your bladder becomes overly full, it doesn't just expand upward, it also presses downward. That pressure pushes directly onto your prostate, which is already a sensitive gland as we age. Think of your prostate like a soft sponge that's positioned right in the path of this downward pressure. Every time you hold urine beyond your body's natural signals, you're essentially compressing that sponge. Over time, this repeated pressure can contribute to inflammation and swelling. Research from respected medical institutions supports this understanding. Studies with men over 60 show that those who respond promptly to urination urges tend to report fewer prostate-related discomfort issues compared to those who frequently delay. In my practice, when patients coordinate this approach with their doctor's knowledge, they often tell me they sleep better and feel less urgency during the day. The science makes sense, and the real-world results speak for themselves. Here's exactly how to implement this approach. What you need is simply to start listening to your body's signals again. When to do it means responding to that first gentle urge rather than waiting until it becomes urgent. How to do it involves 3 simple steps. Recognize the early signal, find a restroom promptly, and take your time to empty completely. What to expect is that most people notice improved comfort within 2 to 3 weeks. Some feel changes sooner, others take longer, both are perfectly normal. The second habit creates pressure from an entirely different direction, and many men are shocked when I explain this connection. It's ignoring constipation. When your large intestine becomes backed up with hardened waste, the pressure doesn't stay contained in your digestive system. Your prostate sits right next to your rectum, and when that area becomes congested, it presses directly against your prostate's back surface. This isn't momentary pressure like holding urine. This is constant, day and night pressure that can last for days or even weeks if constipation becomes chronic. Your prostate, which is already working harder as we age, now has to function while being continuously squeezed from behind. I always encourage patients to mention digestive changes to their healthcare team. Most doctors appreciate when you take active interest in how different body systems connect to your overall health. Research shows us that increasing fiber intake by just 10 grams daily can significantly improve regularity while supporting your body's natural inflammatory response. Evidence indicates this dual benefit, better elimination and reduced systemic inflammation, creates an environment where your prostate can function more comfortably. Here's exactly how to add this support. What you need are fiber-rich foods like sweet potatoes, oatmeal, pears, and chia seeds. When to focus on this means making fiber a priority at each meal, not just occasionally. How to increase fiber involves adding one new source each week, drinking plenty of water alongside it, and giving your digestive system time to adjust gradually. What to expect is that most people notice easier, more complete elimination within 10 days to 2 weeks. Your body will tell you when this pressure on your prostate starts to ease. With your doctor's awareness, this natural approach works beautifully alongside any medical treatments you might be receiving. The third habit affects your prostate in a way that most men never consider. It's sitting for long periods without movement. When you remain seated for hours, the entire pelvic region becomes what I call stagnant. Blood circulation slows down in this area, which means nutrients have trouble reaching your prostate tissue and waste products don't get carried away efficiently. Your prostate is like a small engine that needs fresh blood flow to stay healthy. When circulation becomes sluggish, this gland can't maintain its optimal function. Think of it like a garden that needs fresh water flowing through it. When the water becomes stagnant, the plants struggle. Evidence from major medical research centers indicates that men who engage in regular, moderate physical activity experience significantly fewer lower urinary tract symptoms compared to those who remain sedentary. The benefit appears strongest in men who move consistently throughout the day, regardless of exercise intensity. I work with patients and their doctors to understand that we're not talking about running marathons. Research shows us that simple movement breaks can make a remarkable difference in how your prostate functions. Here's exactly how to implement this circulation support. What you need is just the willingness to interrupt prolonged sitting. When to do it means every 30 to 40 minutes during your waking hours. How to do it involves standing up, walking around your room or house for 2 to 3 minutes, and doing a few gentle shoulder rolls or stretches. What to expect is that many people notice improved energy and less pelvic tension within the first week. This isn't dramatic exercise, it's just reminding your circulation to keep flowing to all the areas that need it, including your prostate. Because everyone's health picture is unique, working with your medical team gives the best results when combining these natural approaches with any treatments you're currently receiving. Now, let me share something fascinating about how these 3 habits work together. When you hold urine, ignore constipation, and sit without movement, you're creating what I call a perfect storm of pressure on your prostate. Each habit alone can cause stress, but together they compound the problem. The wonderful news is that addressing all 3 creates the opposite effect, a supportive environment where your prostate can function more naturally. I'd love to hear about your experience with these areas. Have you found approaches that work well alongside your medical care? Share your story in the comments. Charles, a 71-year-old former firefighter, discovered this interconnection when he came to work with me and his urologist. He'd been sitting for hours working on woodworking projects, holding urine to avoid interrupting his focus, and hadn't realized that his occasional constipation was adding to his discomfort. Within a month of addressing all 3 habits together, Charles noticed he was sleeping more soundly and felt more comfortable during his daily activities. His doctor noted improvements in his follow-up examination. Today, Charles continues his medical care while maintaining these simple habits, enjoying his woodworking hobby with much greater comfort. Your prostate health works like a well-maintained system. As we age, this system naturally requires more attention, which is completely normal. These 3 habit changes help support this natural process by reducing unnecessary pressure and promoting healthy circulation. Research shows this comprehensive approach can help you feel more comfortable throughout the day and sleep more peacefully at night because you're working with your body's wisdom, not against it. The science behind this makes perfect sense when you understand the anatomy. Your prostate sits at the intersection of several body systems: urinary, digestive, and circulatory. When any of these systems becomes stressed or stagnant, your prostate feels the impact. When you support all 3 systems with simple habit changes, your prostate can function in a much more favorable environment. Here's what I recommend as your starting point. Choose one of these 3 habits to focus on first, whichever feels most manageable for your current situation. Spend 1 week building that new pattern, then gradually add the second habit, and finally the third. Most men find that addressing urination timing feels easiest to start with because the body naturally provides clear signals. Others prefer beginning with movement breaks because they can set gentle reminders on their phone or watch. What questions would you ask your doctor about adding these natural approaches to your routine? Comment below your questions. Help me create better content for our community. The key insight I want you to remember is this. Your prostate symptoms aren't necessarily an inevitable part of aging. Often they're your body's way of asking for some simple adjustments in how you support its daily functions. When patients coordinate these approaches with their healthcare providers, they often discover that small changes create surprisingly significant improvements. Your doctor knows your specific situation best, which is exactly what I discuss with patients and their doctors during our collaborative consultations. I've seen men in their 70s and 80s experience meaningful improvements by making these gentle modifications. The research supports what I observe clinically, that supporting your body's natural systems often allows them to function much more comfortably. The evidence continues to grow, showing that these lifestyle approaches complement medical treatments beautifully. When you reduce the daily stresses on your prostate while receiving appropriate medical care, you're giving yourself the best possible foundation for long-term comfort and health. Remember, these aren't overnight transformations. Your prostate, like all body systems, responds gradually to positive changes. Most men notice initial improvements within 2 to 4 weeks, with continued benefits developing over several months as these new habits become natural. What's encouraging is that each of these changes supports your overall health beyond just prostate function. Better hydration habits, improved circulation, and regular elimination all contribute to feeling more energetic and comfortable throughout your entire body. If this evidence-based approach resonates with you, please subscribe for more practical wellness education that honors your relationship with your healthcare provider. Share this with someone who values both natural wellness and medical expertise. The power to support your prostate health lies largely in your daily choices. While medical care addresses the clinical aspects of any prostate concerns, these habit modifications give you active ways to participate in your own comfort and well-being. Together with your doctor's guidance, these approaches can help you maintain the active, comfortable lifestyle you deserve as you age.